Hello, welcome to Ask the Experts. I'm Claudia Otero. Today we're going to be talking about a very important topic, and that is colorectal cancer and the importance of screenings. Our experts today are Dr. Vikram Patel and Daisy Carrillo. Dr. Patel is a gastroenterologist who joined our team at Salinas Valley Health in October of 2022, just a few months ago. Dr. Patel also sees patients at Los Palos Gastroenterology Specialists, Inc. in Salinas. He's also born and raised right here in Salinas, so we are so glad that you've come back and that you are here helping our community rise. So thank you so much.
My pleasure.
And Daisy Carrillo, she's also local, not from Salinas, but from Gonzales, born and raised there. Daisy is a registered oncology nurse at our Susan Bacon Cancer Resource Center. Welcome. I'm so grateful that you're both here. As I mentioned a few moments ago, this is a very important topic. According to the American Cancer Society, colorectal cancer is the third most common cancer diagnosed in both men and women in the U.S. It's also the third leading cause of cancer-related deaths in both men and women, and it's expected, sadly, to claim the lives of about 52,550 people in 2023. Now, the age for colon cancer screenings has gone from 50 to 45. Why is that?
You're absolutely right. So in the U.S., we started seeing an uptick of colon cancer incidents throughout, various populations, and because of that, previous guidelines used to say start colorectal cancer screening at the age of 50, but because of the recent uptick and us seeing colorectal cancer in younger patients, the guidelines now recommend starting screening in average risk patients at the age of 45.
Average risk. So what about high-risk patients?
High-risk patients, it depends on their risk factors that they have. We're going to talk about that in a little bit. So we'll talk about
Okay,
that.
so we'll hold on to that question there. Okay, so Dr. Patel, how does colorectal cancer begin?
So colorectal cancer or colon cancer typically begins when cells on the lining of the surface of the colon start to change in their characteristics and they start to proliferate or replicate in an uncontrolled fashion. And over time, these growths, which we refer to as polyps, can eventually turn into cancer. Yeah, so what are polyps? Polyps are, like I mentioned, these uncontrolled growths of cells that have now clustered together and formed this growth of tissue called a polyp. Here on this slide, here on the top left, you can see a picture of a normal colon wall. And then right below it, from the left side, the second photo down, you see a pretty large polyp, and that's a polyp called a pedunculated polyp. So these polyps do grow in various sizes and shapes. The one below that, the third one from the left, is more of a stuck-on, flatter type of polyp. Regardless, all these polyps we do encounter during a screening colonoscopy, and we can remove it right then and there. The problem is when these polyps are not removed is when they can turn into cancer. And how do we remove these polyps? So during a colonoscopy, you can see on the top left, the endoscopist has encountered a polyp. And afterwards, the endoscopist will pass a tool called, in this case, a snare, and lasso around that polyp. And once they lasso around it, they can snip it off, and that's what you see on the bottom left. And then once we snip it off, we can suction it into our colonoscope and send it off for further testing. And then that area on the bottom right, you can see after the polyp has been removed, will heal up on its own.
Now, will the patient experience any pain afterwards when the polyp or polyps have been removed?
Generally, this is a painless part of the procedure. The patient should not feel any pain during this part of the polypectomy or removal of the polyp. The problem is when that polyp or any polyp which has cancer potential does not get removed, over time it can grow and keep growing to the point where it becomes a colon cancer. And that's what you see here on this slide.
Is colon cancer, colorectal cancer curable?
So early detection is key. And that's why we stress screening and getting checked, because when we find these at their earliest stages, treatment is much easier and curable. Sometimes during the colonoscopy itself, the entire polyp or an early stage of a cancer could be removed right then and there during the colonoscopy. And as this colon cancer starts to invade the walls of the colon or starts to spread to different areas around the colon is when the treatment gets a little more tricky and complicated.
Okay, and then what are the signs and symptoms? I mean, what do people really need to look out for?
Yeah, so for signs and symptoms of colon cancer, Going back to early detection again, the reason why screening is so important is because in its earliest forms, colon cancer may not show any signs or symptoms. And so we usually just pick it up during screening itself. But once it progresses, more commonly patients will experience changes in their bowel habits. Some patients may experience a change in their shape, or they may say their stools are starting to look more like a pencil shape or a snake-like shape. Other patients may present with iron deficiency anemia or rectal bleeding. Some patients just have vague abdominal discomfort, or they may have constipation, diarrhea, and then unintentional weight loss. Those are some of the bigger ones. Some patients could feel a little lump in their rectum, or they might feel a lump in their abdomen, but those are less common signs and symptoms.
All right. Well, thank you for sharing that information with us. I think that's very important for all to know those signs and symptoms. Daisy, what are the risk factors?
Yeah, so when we think of risk factors, we think of things that sets us at risk for diseases such as colorectal cancer. All cancers have different risk factors, and some risk factors are modifiable, so things that we can change, and some risk factors are non-modifiable, things that we have no control. We cannot change these things. And those include age. So the older we get, the higher the risk. Our race and ethnicity. Also, your personal history of inflammatory bowel disease, including ulcerative colitis and Crohn's disease, personal history of colorectal cancer, or family history of colorectal cancer.
But the good news is that we can change some things, correct?
Yes, that would be our modifiable risk factors, or things that we can change, which include our diet. So avoiding diets that are high in red meats or processed meats. Our weight, obesity. We need to work on our weight management, staying active and getting some sort of exercise, avoiding alcohol and tobacco.
Not too difficult to do.
Not too difficult.
All right, thank you for that. Let's talk about the different types of screenings for colorectal cancer. What are they?
Sure, yeah. So for average risk patients in the US, there are several different screening tools that could be used. And I'll start off with the colonoscopy. The colonoscopy is the only test that can prevent and detect colon cancer at the same time. So during the colonoscopy, I mentioned earlier, we can find polyps and can remove them right then and there while we see them. So for the colonoscopy, the hardest part is the day before and for the patient. And that's when we tell the patient to be on a clear liquid diet the entire day before.
Lots of Jell-O.
Lots of Jell-O, lots of apple juice, some Gatorade. And then late afternoon, early evening, they will start taking a laxative, and that's primarily to clean out the colon. And that laxative is decided between the doctor and the patient at a prior visit. And then the patient starts taking that laxative, and you can imagine they're running to the toilet a lot, so that is the worst part of the colonoscopy. The next day, the patient comes into the endoscopist's office or the hospital, and the patient's given a little bit of sedation. And after they're sedated, a camera with a light and tube called a colonoscope is introduced into the rectum. And during that time, that colonoscope is examining the entire lining of the entire colon. And if anything looks abnormal, it can be biopsied right then and there. If there are any polyps or growths, such as the ones that we saw earlier in this presentation, those can be removed right then and there as long as it's safe. Aside from that, the endoscopist, after the procedure's finished, will decide when the next colonoscopy should be, depending on the findings during the colonoscopy.
I see. And when they find polyps and they remove them, I mean, how much longer does that procedure take?
It depends on the polyp and the size of the polyp. Very small polyps are really quick to take off, doesn't add much time to the procedure. Some larger polyps that might need various tools or injections or some cauterization or burning might take a little bit longer. But it all depends on the size of the polyp. And then after colonoscopy, other screening forms. There's a FIT test, also called the fecal immunohistochemical test, and that's a stool-based test. And what this is doing is it's testing for a protein that's found in human blood called globin. And that's a stool-based test. It can be done every year to screen for colon cancer. Another test that's used in primary care is called the FOBT, also known as the fecal occult blood test. This is a little less accurate than the FIT test that I just talked about. It does require 3 samples, and this detects blood in the patient's stool. And there are some dietary restrictions when submitting these stool samples. but it is less commonly used than the FIT test when it comes to stool-based testing. And then after that, there's a radiological test called the CT colonography, which is sort of, think of it more or less as a CT scan of the colon. This test does involve a preparation, so you do have to clean out the bowel. The only difference is you're not being sedated, and it's more or less a CT scan of the colon, so you can find large polyps or cancers. And this is something that can be done on a every 5-year basis. And then you have a sigmoidoscopy, which is similar to a colonoscopy, but you're not going in all the way. So you can imagine that if you're not going in all the way, things on a certain part of the colon could be missed because you're not directly looking at that. But the sigmoidoscopy is going in only about a third of the colon and taking a look there, and anything that's abnormal there is removed. If there's any polyps or cancers there, those can be treated on that side of the colon. And that's done every 5 years, but if you do add a FIT test with the sigmoidoscopy, then it can be done every 10 years.
And who would actually undergo that last
The
procedure?
sigmoidoscopy with the FIT, I think it's mostly just patient and physician preference. If the patient prefers having just a sigmoidoscopy with the FIT test, then they would go through that way. But I see it being used more commonly in areas where you don't have gastroenterologists to do the full colonoscopy. Some physicians who are non-gastroenterologists could do sigmoidoscopies, and then they may use that as a screening tool. And you see that more in sort of rural areas or areas where there's not enough, trained endoscopists.
Okay. Now, you do perform colonoscopies.
I do perform colonoscopies.
And I'm assuming here, but correct me if I'm wrong, out of everything that you just mentioned, is that the best screening available?
So when you say best, it depends on the patient. Some patients who are, if they're average risk, then any of these tests could be used theoretically. When it comes to best, I would say yes, the colonoscopy is the best because you can detect and treat right then and there and prevent progression to colon cancer of any of those smaller polyps. Some of the other tests could potentially miss smaller polyps or may not be as accurate as a colonoscopy. Another test that I didn't talk about was a stool-based DNA test, and that's Cologuard. You may have heard about it, in commercials, or you may have already had it already. But this is similar to the FIT test, but it's testing for cells that have been mutated in your stool and with the presence of blood. And that is a test that's done. It can be done every 1 to 3 years. Typically, you would probably see it every 3 years being done in our area. And if that's positive, then you go on and get a colonoscopy to go look for actual polyps.
I see. And I think you brought one along.
I did.
Stacey. Can you show us what it looks like and how it comes in
can,
the
of
mail? There is a
course.
prescription for this, correct? So it gets delivered to your home?
That's correct. By prescription only, so you do have to talk to your primary care provider about this if you're eligible and meet the criteria for this test.
So this is the box that it comes in.
This is the box that it comes in. Once your provider orders the kit, it gets shipped to your home. Once you open the bag that's in the kit, the first thing that's there is the labels that you will have to complete to put on your samples, and then you have instructions in English and in Spanish. And what comes in the kit is this that you're going to place right over your toilet seat. You're going to grab the big container. You're going to open that up. Sorry, put that here. Place this on top of this, and then you're ready to provide your sample. Once that's collected, we want to avoid any urine in the sample. And if you're during your menstrual cycle for women, you need to avoid doing it during that time as well. So you collect your sample, and then you have another little container here that once you have your sample, you're going to set this aside and open this container. And you have little ridges on this tube that you're going to use to help you decide how much stool. You do have to collect some stool on top of this, insert it back in, and that's ready to go. You can set that aside. And then you're going to pull out your preservative, pour it into your collection container here, grab your lid, and close it back up. Once that's nice and tight so that you don't accidentally spill that, you are going to label it. So it has two labels. One is for this kit here, and the other is for this small container. Once it's labeled, you're going to put everything back in here. So this bag stays attached. You cannot remove it from the kit. You're going to seal everything back up. Close it. And you will have a return label here on your kit. So you're going to go ahead and make sure that that's attached and call your UPS and have them either pick it up at your home or you can deliver it to your local UPS store.
Very nice, fairly easy.
Very easy.
Takes just a few minutes or so, and it's off.
Yep.
Okay, well, thank
The
you so
comfort
much.
of your own home.
From the comfort of your own home, so there's no excuse to get this done.
No.
As an oncology nurse, Daisy, at the Susan Bacon Cancer Resource Center, how do you help patients with cancer?
So my role as an oncology nurse navigator is meeting with the patients and their families to provide ongoing support, whether it's just educational, care coordination, resources in our community, like transportation, financial assistance programs, grants that are available nationally, and just making them feel comfortable that they have someone that they can reach out to and say, hey, Daisy, I'm having trouble with connecting with such clinic or my provider. I have some questions and I'm not sure who I need to ask. Then they can just reach out to me and I can help facilitate those questions to their providers or help answer them as well.
You're there for
the patient.
journey. You're really there for
From beginning to end and to survivorship as well.
Yeah, and I can't imagine what it's like for a person who has just been diagnosed, whose world just came crumbling down, per se, to have a diagnosis like this. But how wonderful that we have nurse navigators, oncology nurse navigators, who can be there and really help pick up the pieces, right, and guide them through their cancer journey and treatment. So how wonderful.
Yeah.
Thank you for all you do, and
You're
to your colleagues as well. We know it's not just you. There are
No,
many others.
so we do have a social worker at our Cancer Resource Center who provides the psychosocial support of this journey, and we have support groups for our Cancer Support Women's group, and we take hair donations as well.
Yes, yes. I'm so glad that you mentioned the hair donations, because over the years we have had people of all ages, men, women, seniors, even little boys and little girls who have let their hair grow, and they have gone in with mom and dad and they've gotten their hair cut, and they come in and they have this little ponytail or a braid, and they've brought it to your office at the Cancer Resource Center at 501 East Romey Lane, Suite C, by the way, if you're interested. With their donation, and it's just the most wonderful thing, because then that hair is sent off. And do you want to tell us what happens after that?
Yeah, so when they come in with a hair donation, we do have to make sure that it's at least 10 inches long, non-bleached hair, and that's pretty much it. They need to bring it in a ponytail or with a band attached to it. We have them complete a form, a donation form, and it gets shipped out. And they receive a certificate in the mail from that vendor that receives that hair.
Right, and the hair is used for wigs which are then donated to cancer patients in our community. So that's always great. It always comes back. So again, I encourage you, if you're letting your hair grow, if it's not bleached, at least 10 inches long, please consider making that donation. You really will be helping patients in our community.
And I also forgot, we do have educational material such as these that are available free to our patients.
In various languages.
Yes, English and Spanish. You can just walk in and look through our education material that we have available and take for free.
And I believe most of the staff at the Cancer Resource Center is bilingual.
At least 50%.
At least 50%. Okay, it was close, but that's still a lot. So that's fantastic. You can always ask for Daisy.
Yes.
Okay. Tell us a little bit more about some of the other services provided at the Cancer Resource Centers, because it's really a lot, and the majority of them are free, and that's really important to point out.
Again, as I mentioned, the support group that our social worker facilitates, that's free to women who are affected by cancer. We also hold the advanced care planning classes there. Our palliative care social worker is the one who facilitates those classes. And again, care coordination between, we have a breast nurse navigator, and then I'm the general cancer nurse navigator.
Okay, and again, I think also when patients are undergoing infusion therapy or chemotherapy, they are also given a bag, right, with all sorts of goodies that they can use when they're receiving treatment or at home, and obviously, and actually even gas cards,
Gas cards
groceries,
and
cards,
food cards,
if
and we
needed.
help arrange transportation as
Right,
well.
right, because sometimes you do have to go out of area for treatment, and so you're there for that. So again, and the most beautiful thing of this is that you don't even have to be a patient of our clinics or hospital to receive some of this assistance. So for more information about all the free services that the Cancer Resource Center provides, the number right there on the screen, 831-759-1951. I repeat, 831-759-1951. Dr. Patel, how do we treat colon cancer or colorectal cancer?
So yeah, colorectal cancer, it can be treated various ways. It all depends on the stage that it's detected and location. So when we go back to the colonoscopy, if it's in its earliest stage and it can be resected right then and there during the colonoscopy, then that's something that we can do. If it starts invading the walls of the colon, then we start thinking more towards, surgery, where, that piece of colon can be resected from the outside. And then if it's gone through all the walls and it's starting to spread around the adjacent organs, then it could involve some chemotherapy. And depending on the location, sometimes if it's more close to the rectum, like closer to the anus, then radiation may be needed as well.
Okay. But it's important to know that we are all there for you.
Right.
So thank you for that. I think some of the important takeaways from this presentation are, and add to them if you like, is that we should start our colon cancer screenings at age 45 or earlier if there is a family history of colon cancer.
Actually, for average risk.
For average risk, thank you. Screenings save lives, and there are several screening options, as you have discussed and even shown us, Daisy. Cologuard is safe and can be done from the comfort of your home. You do need a prescription, and it gets sent to your home. Colon cancer or colorectal cancer, you just mentioned, can be treated effectively if detected early. If you would like to schedule an appointment with GI specialist Dr. Vikram Patel at Los Palos Gastroenterology Specialists, Inc. in Salinas, please call the number there on your screen, 831-424-8888, 831-424-8888. Well, I want to thank you both so much for being here today. And before we wrap up, is there anything that you want to add, say to patients out there, or just about what you deal with every single day?
Yeah, I think we kind of hit it home here with the screening. That is the easiest thing you can do to prevent yourself from getting colon cancer. And we have all these different tools that, if you're afraid of a colonoscopy, there's different types of, screening available for those who are at average risk. But the most important thing is don't put this off. If you are in that age range, or if you are one of those patients that need to be screened, there's no point in delaying it.
Okay, Daisy, anything else?
And if you don't have insurance, and feel like you're at the average risk factors, have average risk factors, and feel that you want to move forward with any screening, reach out to me. And there may be national programs that help provide at least some financial assistance to help cover the cost of a screening.
Very good. Well, thank you very much. And on behalf of Salinas Valley Health, I want to thank you both for everything you're doing for the community, and of course for being here today and communicating all this wonderful information to our community members. So thank you for being here.
You're welcome.
You're welcome.
Thank
you. Well, this presentation will stay right here on this Facebook page. Please like and share it. I know both of you will.
Yes.
And everybody else here. No, seriously, we would really appreciate that. And the information, it's here, it's free, so we want you to please share it throughout the community. To learn more about our Ask the Experts presentations like this one, to listen to our Ask the Experts podcasts, to watch other educational health videos, or to stay up to date about our community events, such as Walk with a Doc, please follow us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. And of course, we encourage you to visit our website, salinasvalleyhealth.com. There you can find out more information about our physicians, our services, our specialties, our programs, and even events. salinasvalleyhealth.com. Thank you for watching. I'm Claudia Otero. We'll see you next time. Take care.